Hey, sports pharmacist, it's Ashley with the International Sports Pharmacist Network. Thanks for joining us. Today I have with me Dr. Mitch Howard, who's going to tell you a little bit about what he is currently doing in his practice. Thanks for joining me today.
Thanks, Ashley. Yeah, I appreciate the opportunity to talk to you more about sports pharmacists.
Yeah. You mind giving us a little bit of an introduction as to what your current practice is like?
Sure. So as Ashley mentioned, I work currently in an academic center at the University of Toledo as a clinical assistant professor. Outside of my teaching responsibilities here at the college, I also am a clinical pharmacist in an ambulatory care clinic with our internal medicine team here at the University of Toledo Medical Center. And then also on the side, I also work at some of our local community pharmacies as a community pharmacist for evenings and weekends as needed.
Great. Well, that's really diverse. And that really, I find that even though I have my little side job that I do, keeping current with a clinical practice in active practice setting really helps. So would you mind telling us about your path that you took into sports pharmacy?
Of course. So I think probably looking back at most of it, a lot of it goes back to, childhood playing and watching sports. Involved with multiple sports throughout high school. And then as I grew academically in a pharmacy, it wasn't really until I had graduated and started my residency program that I asked myself the question of how could I merge these two passions together. So early on in residency, I was supposed to be coming up with a research project for my residency. And at the time had the Rio Olympics on my computer on a second screen, and then started to wonder, hey, maybe there's healthcare providers at these games, and started Googling and searching into it, and discovered that there were. And so then I wondered, how could I just take my research project and kind of twist it into that. So my residency was focused on community pharmacy, and so I wondered what perspective I could take from that. And so that's when I started to think about sports supplements that are in our over-the-counter aisles. And so I took that and I surveyed pharmacists on their knowledge, their confidence, and their enthusiasm about providing counseling on these types of products. But then not only pharmacists, but I looked at the athletes. So I surveyed local athletes at gyms through local listserv groups for athletic organizations about what products they use, what factors go into their selection, and where they get their information, and what they thought about pharmacists providing that. And so that was kind of that initial trigger into it. And then since then, I've been able to network and find more opportunities, completed the IOC's drug and sports certificates. I've provided a few lectures to our athletic training program here at the University of Toledo. And then also even this spring, help provide COVID vaccines to our athletes in the training room.
Oh, excellent. Yeah, that's wonderful. I mean, I often find that the interest when a pharmacist is becoming a sports pharmacist is a merging of these two interests is so organic, and it makes it so interesting, and each sports pharmacist has their own path. And so looking back at your experiences that you've had putting these two interests together and working it into your career, would you mind giving some pharmacists who are watching just a little bit of insight of what you think is the best path that someone might take, or what training they might try to receive in order to become a sports pharmacist?
Yeah, so I think, number one, as I've learned over the last few months, years, is network. I didn't realize how many people had this interest until I met someone else and we started chatting, and ever since then it's grown exponentially. And I think, networking also means outside of pharmacy as well. So I mentioned, providing lectures to our athletic training program. I've created some great relationships with those faculty members that are over there, and look forward to continuing that and growing that. I would say number two is just read. May even be refreshing, making sure you're up to date on your pharmacology, medicinal chemistry, and even just reading articles about what sports pharmacists have done so far, whether it's patient education, anti-doping, clinical practice, ways that they've worked to kind of provide some counseling in there as well, and start to ask yourself, what can you do better, because there's always those limitations of those types of studies. And then I would say the last piece is just be aware, be innovative, and ask questions. I think that's And one of the biggest things that I think we've all kind of individually discovered ourselves and now have networked together, find those opportunities to get involved. Early on, I read an article from the Pharmacy Times that interviewed Peter Ambrose, and he said he was asked kind of a similar question, and his response was to blaze your own trail. And so be innovative, find those ways to get involved. And I think you'll find excitement and things that you're passionate about and the way that you want to go with sports pharmacy.
Yeah, I definitely would support that 100%. I find that the pharmacists that go into sports pharmacy are often pioneers, and they have great resilience. They are persistent in following their path, and that really gets them to where they're going, because oftentimes you're going to hear no, or how would a pharmacist fit into that? And so many times they're finding the way, or they're demonstrating value. And just going back to the article that you published with the research that you did, I have referenced that so many times and used that to build my own concepts and how I've decided to move forward with, doing my practice of sports pharmacy as well. So I appreciate that.
Yeah, well, it's good to hear that people are reading the article.
Yeah.
That was the purpose of publishing it, to get it out there and add to the literature.
Yeah, absolutely. Yep. And then lastly, what do you think could be one of the primary contributions that pharmacists could make in sports pharmacy?
As I've kind of, I'm involved in a lot of different areas. I think there's lots of areas for sports pharmacists, but I think the first thing that comes to mind is education. And I realize that's a wide topic because you could provide education to anyone. It could be your patients, which would be your athletes, other healthcare providers, whether it's physicians, nurse practitioners, physician assistants, athletic trainers, dietitians. Even if, maybe they have a sports medicine focus, there are those healthcare providers who don't, but they're still treating the athletes. And so they need to be aware of any rules or regulations that they may need to follow. And it also could be, you're the athlete support personnel. Think about coaches, parents. I think this education could start from a very young age. And I know WADA is doing a lot to provide that type of education, different modules for all types of people who would be involved. So I think having pharmacists involved in those type of initiatives would be big.
Yeah.
And some of that education could be as simple as our regular counseling about OTCs or prescriptions. An athlete with a controlled disease state can function at a much higher level than one who maybe is kind of struggling with it or has it moderately controlled. Or you could even be more specific into, sports pharmacy and think about, the banned substance list and really get involved with that and anti-doping. So I think there's lots of avenues, but education, I think, is always the foundation of a lot of these initiatives.
Yes. Yeah. Yeah. And that's another point that I've thought about a lot lately with, having this consistent message. Who better than to provide drug information to the individual patients that we're working with than the pharmacists themselves? That's a personal pharmacist to that patient. And when the pharmacist knows the messaging from WADA or USADA or NCAA, then they can then personalize that for their patient athlete. So yes, I agree with everything that you said, whether it be to the individual patient or to other healthcare providers. So, it's an awareness that we can definitely work to increase people's awareness of what we're capable of. So I truly appreciate your time today. Any last words before I let you go?
I would just like to say thank you again, and hopefully anyone who's watching is starting to blaze their own trail and ask those questions, and feel free to network with you and any of the pharmacists that you've interviewed in the past and also moving forward into the future.
Yeah. It's a small group that we have, and I encourage people to go to sportspharmacist.org and please leave your comments below. Like and subscribe to this channel. Thank you very much for your time. And thank you, Mitch.
Thank you.